This week, we're going to learn about substance use disorders. We're going to see lots of clients when we're out in the work field, and some of them may be addicted to tobacco, alcohol, or some drugs. And let's look at what can happen when they do get addicted and why it matters. What are some dental implications if someone is addicted to these substances? So these are the topics that we're going to be looking at. People can abuse drugs, and we'll look at how. So first thing to note is that when someone says abuse of a drug, what that basically means is that they're using the drug for non-medical purposes. So they're using the drug not to treat themselves for any pain. It's usually, if they're abusing it, they're using it to make them feel good. They're using it to altering their consciousness. Misuse is when they're using a drug in the wrong dose. So if they're taking a drug, they're using a higher dosage. Or if the drug is only prescribed for 7 days, they're using it for 10 days or 20 days or forever, right? So misuse is when they're using the drug the wrong way. Abstinence syndrome is when someone is free from drugs. So someone has stopped taking drugs. So usually when they're in a treatment program, they eventually abstain from drugs, which is known as the abstinence syndrome. So again, drug abuse looks at when you self-administer, so you yourself is taking the drug in a socially unacceptable manner, so in a manner that doctors would never agree with. And it often always results in negative consequences, so it often always results in some harm to your body. Drug dependence, this is when you are dependent on that drug, when you need that drug. If you don't take that drug, you won't feel the same. So when you're so dependent, when you're addicted really to the drug. Enabling, so here are some more terms we're going to look at. Enabling is when other people kind of encourage you to continue using drug abuse. So maybe they're not necessarily doing drugs, maybe the family and friends are not doing the drugs, but they are encouraging the person to take the drug. So they're enabling the continued drug use. Withdrawal, so withdrawal is when someone stops taking the drug. Sometimes what happens is you get a variety of symptoms like nausea, sweating, runny nose, diarrhea. There's so many, tremors, right? Seizures maybe. So there are so many withdrawal symptoms that could happen when you stop taking a drug that you're addicted to. Psychological dependence, this is when we rely heavily on that drug, because if we don't, then we won't be able to continue with our day-to-day lives. We need our drug so that we can continue. And this is when you're psychologically dependent, when you're emotionally dependent on that drug. You need that drug for you to function throughout the day. Physical dependence is when your body has changed. And the reason why your body has changed is because you're so dependent on that drug. And when you need that drug, typically what happens is you need increased drug concentration. So what that means is that when you take a drug, you'll need more and more of that drug to get that altered physiological state, to get that changed body, that high feeling. You need more and more drugs. And so you're so dependent on that drug. And what they say is that when you quit taking this drug, immediately you're going to feel you're going to get withdrawal symptoms. Immediately you'll feel nauseated, you'll feel irritable, you'll feel like you have tremors, shaking body, right? All those symptoms will come up. So physical dependence is when you are so dependent on that drug that when you stop taking that drug, you will have a lot of withdrawal symptoms. And what they say here is that the withdrawal symptoms like nausea, sweating, and all that is often opposite of the symptoms of the abuse of the drug. So that means that when I take this drug, for example, I feel good. I don't sweat. I'm not nauseated. But when I stop taking this drug, well, that's when I'll start sweating. Well, that's when I'll start feeling nauseated. So it's the opposite effect. The drug makes me feel good. When I stop taking the drug, I feel the opposite way. I don't feel good. Tolerance. So drug tolerance is basically when if today I take this drug, all I need is this and I'll feel fine. Tomorrow or next week or next month when I take the drug, I need double or triple or quadruple the original amount for me to get that same effect, for me to start feeling good. So drug tolerance is when you're increasing the number or the dose. So if I were to get addicted to a drug, what happens before addiction is habituation. And this is basically where it's I'm starting to get dependent on that drug, but not to the point where I crave it intensely, not to the point that if I had to quit taking that drug, I won't feel any withdrawal effects, I won't feel any withdrawal symptoms, I won't get nauseated or I won't sweat. However, when I'm addicted to a drug, well, this is where if I were to quit taking that drug all of a sudden, I could have severe withdrawal effects. I could have tremors. I could have seizures. I desperately need that drug. I have intense craving, whereas with habituation, I don't really have that craving, right? So addiction is worse. Habituation is not that bad. It's just short of addiction. That's what it says here. So let's say I'm addicted to a drug and I stop taking it. And when I stop taking it, now I'm going to have withdrawal symptoms. So like nausea, sweating, tremors, shaky body. So what people do, what doctors do, is they'll give you a different drug. Okay, still a drug, but they'll give you a different one. And that drug is supposed to help with the withdrawal symptom. And when they give you a different drug, when they substitute that original drug with a different one, it's known as cross-tolerance or cross-dependence. So for the purpose of this class, think of these two as the same term. Okay, so this is when you substitute your original drug with something else, with a different drug. And the purpose of that is to stop or decrease the withdrawal symptoms.